Now, earlier, we spoke to Victor Khanyile about the over 284 qualified doctors who remain unemployed. He's the Health Department's Workforce Management Director. Now, let's try to get more understanding on this issue with the Chairperson of the South African Medical Association, Dr Angelique Coetzee. A very good morning to you, Dr Coetzee, and thank you so much for your time this morning. So, this placing of doctors only in January and July, is this really something that happens in this country?
Yeah, well, it happens in this country. Good morning to everyone out there. This is an old, ongoing problem. Never been resolved since, I can't remember since when. So I need to put it on record that when you enroll as a first-year medical student, it is common knowledge and statutory obligation that after 6 years, you will need to do your 2-year internship. We can't get away. So if you plan, when you enrolled your first-year students for 6 years ahead, we should not have this problem. We accept that there would be students that don't pass and would then be eligible to apply in the middle of the year. That's the July intake. So I need as well to make people understand that interns is the group after you have finished your undergraduate study. You then become an intern for 2 years. There are certain blocks that you need to do. You're not allowed to go and work as a medical doctor, do COVID patients, do vaccinations. You're still there to study under supervision. So therefore, these posts need to be accredited. So there's 3 things that needs to happen. They need to be allocated to a certain hospital or province. Then they need to be accredited, that there is enough supervision for these interns to work under. And then the most important thing, they need to be funded. So for now, we know that there is enough funds for 118 confirmed interns for July intake. That we know. So that's a given. Then there is an additional 213 accredited posts, but not funded. So it's more because the total outstanding or the total interns is 288, less the 118 that's already been confirmed. So there are more accredited posts, but now this is the trick. They're not funded. And this is a problem of the provinces as well as Treasury. The provinces need to open up the space. They need to get the funding from Treasury. And it seems to us that for the past, I've said how many years, they can't get this right. It's a shame.
Doctor, I imagine you've brought this forward to government and these different provinces over the years, because you did start off by saying it's a problem that has been happening for years on end. I would imagine SAMA has raised this time and time again.
Yes, we did, and we are trying to assist. And in the end of the day, you know, the likes of Mr. Victor Khanyile is getting a hard time because everyone thinks he's the problem. He's the oversight. He gets the information from the universities. Once the doctors pass their final exams, then that needs to go to where there's allocated posts and accredited posts, and then there must be funding. I can't believe that it's so difficult for Treasury and the provinces to get this right. You know, after how many years, you should have a system in place. Treasury should know exactly what amount of students they need to have make money available. Provinces need to know where are their hospitals, how easy is it to get in there, and to accredit and allocate a post there. You cannot let interns work without supervision. They're not mini doctors. They need supervision. And unfortunately, regarding the rotation, they have, as I've said, they have certain blocks. So one block is 6 months. That's the family medicine block. So you cannot allow a student to join in any time of the year after he have passed his exams. especially if it's in the middle, if they haven't made, through the years on a yearly basis pass the exams. So because of the blocks, and you need to work your time, there's allocated time for you to learn. So from SAMA side, the only thing that we can now ask these students, please do not fail. Please do not engage in other affairs which take your attention away from your studies. Because if you do that and you fail and you have to get into the middle of a year, it becomes a huge problem and you compromise yourself. Because at this stage, our government doesn't have the ability to make funds available. It seems it's a huge mess. We can see what is happening in healthcare. We see it with the vaccines. We see it with, bureaucracy telling us there's enough hospital beds, there's no crisis. We see it everywhere. Guys, there's a problem. There's a huge problem.